Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. The topic for this episode is clinical factors associated with positive corneal culture in suspected microbial keratitis. And now I'd like to thank our host, Dr. Tom Quinn, our topical expert, Dr. Aaron Zimmerman, and our topical editor, Dr. Kelsy Steele. And now it's my pleasure to begin today's podcast.
Welcome, you of curious minds, to the American Academy of Optometry's Clinical Podcast Series. Today, we're going to look at answering the question, to culture or not to culture? That is the question. And our guest expert for today is Dr. Aaron Zimmerman. Dr. Zimmerman is professor of clinical optometry and chief of student health optometry services at the Ohio State University College of Optometry. Welcome, Aaron.
Hey, thank you for having me, Tom. It's a pleasure to be here.
It's a treat. It's a treat. And everybody, I'm Tom Quinn, your host for today's event. We're going to discuss a paper that was authored by Matthew Green et al., published in the December 2021 issue of the journal Contact Lens and Anterior Eye. So, Aaron, what did the authors want to explore in this paper?
Well, Tom, the authors are trying to identify whether any microbial keratitis risk factors or clinical signs were associated with obtaining a positive corneal culture result.
Okay, good. And why is that important?
Yeah, well, as you know, corneal culturing is kind of a finicky thing. As stated in the introduction of this particular article, positive culture rates in their own studies down in Australia vary between 42 and 71%. And then from my own experience of culturing a few contact lens microbial keratitis cases, you don't always obtain a positive culture. And additionally, I was a member of the contact lens assessment in youth study group. And one of the papers one of the studies we ran, we actually tried to culture individuals' eyelid margins and bulbar conjunctiva. Now, these individuals were not microbial keratitis patients. They were individuals with corneal infiltrated events. But our culture positive rates from those samples were around 25% from the eyelid margin and 17% from the bulbar conj. So, it can be somewhat unreliable when you're trying to obtain these things.
Yeah.
The goal, right, would be if a microbe can be isolated, then you can select a medication that is known to be effective against that particular microbe.
Right. Before we talk about the results, Aaron, you mentioned that this study was done in Australia. Is that something that the reader should be keeping in mind? Does that affect how we can potentially apply it to patients, for in my case, in your case, here in the U.S.?
Well, I think the good news is a lot of the microbes that are found with contact lens complications tend to be environmental or normal flora. But, we always can think of like Pseudomonas, for example, and that is a waterborne microbe. And that is one of the microbes that was found a lot in this particular retrospective analysis, but that's also found here in the United States and elsewhere. So I do think that the data that were collected do translate pretty well to different geographic locations around the globe. Okay, great.
Before I ask you what the results were, you did mention contact lenses, so I'm suspecting they're part of the puzzle here. Go ahead. What did they find out?
Yeah, exactly. So in the univariate analysis, positive cultures ended up being associated with individuals who had microbial keratitis because of contact lens wear, patients who were over age 60, patients with entering visual acuity of 20/80 or worse. And then some signs that were associated with positive cultures were a large central epithelial defect, anterior chamber reactions that were grade 2 plus or worse, a defect of 2 millimeters more in diameter, And the last one was no prior treatment with antibiotics. Now, those univariate findings were thrown into a multivariate model. And following that analysis, the things that stuck were visual acuity of 20/80 or worse was pretty strong. Those who wore contact lenses and developed MK, over age 60, the anterior chamber reaction stuck around, and no prior treatment with antibiotics. And the investigators ended up doing another analysis, and they calculated that the highest attributable risk percentage was the visual acuity of 20/80 or worse. Okay, so if you had a patient entering with a visual acuity of that, your odds of finding or obtaining a positive culture were pretty high. They also looked, and they looked at each of these factors, and they concluded that patients who had 4 or 5 positive factors had a 100% likelihood of obtaining a positive culture.
Wow. Okay.
So,
and then as those numbers went down, then the percentages went down as well.
Yeah, 100% right. You're exactly right. Yep.
Okay, great. Well, I think we learned a few things about whether to culture or not to culture with a given patient in the chair. If they're contact lens wearer, if they're older, if they haven't been treated with antibiotics, and then if they showed some of those signs that you just reviewed so eloquently. Wonderful, exactly. Aaron. Thanks for your insights on this paper. We appreciate your input. And everyone, thank you for listening.
And a special thanks to CooperVision for their educational grant to make it all happen.